This lecture will go over Chapter 6, Infection Prevention and Control, in the MedSurg textbook. Normal flora, these are microorganisms that normally exist in the body and provide us a natural immunity against certain infections. These are most often found in or on body systems that have some form of contact with the outside environment. Normal flora will prevent the most harmful microorganisms from colonizing within the body. Understanding how the body defends itself against infection and how to prevent further exposure from pathogenic or disease-producing microorganisms is crucial to providing safe and effective nursing care. An infection is the presence and growth of pathogenic microorganisms in a susceptible host. Infection can be communicable, which means that it is passed from one person to another directly through touch or indirectly through using a contaminated object, or non-communicable. Disease is one possible outcome of an infection. Once an infection has occurred, the person is considered communicable until the organism is no longer shedding. This means to lose by natural process from the body. Once the organisms have found a place to multiply, they can then spread throughout the body via our circulatory or lymphatic systems. The development of an infection is dependent on the interrelationship among the host, the agent, and the environment. Risk of exposure is influenced by lifestyle, occupation, socioeconomic status of the host, the underlying disease state, as well as the immunologic and nutritional status of the host will also influence the degree of resistance or susceptibility the body has to the pathogen. Any microorganism capable of producing disease is known as a pathogen. Pathogens can be transmitted from one person to another through one of three routes: airborne, contact, or droplet. Hand hygiene is the primary way to prevent the spread of transmission of pathogenic microorganisms. 6 categories of microorganisms are known to cause infections in humans. Bacteria, this includes Rickettsia, Chlamydia, and Mycoplasma. Viruses, protozoa, fungi, helminths, and prions. Bacteria are classified into 3 major categories according to their shape, Gram-staining properties, and requirements for oxygen. Round or spherical bacteria are referred to as cocci. Rod-shaped bacteria are referred to as bacilli, and spiral or corkscrew-shaped bacteria are referred to as spirochetes. Some bacteria grow in chains, like streptococci, and others grow in pairs, known as diplococci, and some will grow in clusters, known as staphylococci. Bacteria that require oxygen to live and reproduce are considered aerobic, and those who cannot tolerate the presence of oxygen are anaerobic. When bacteria enters the body, they trigger an immune response to produce antibodies. Some bacteria can produce poisonous substances called endotoxins. Others can produce exotoxins. Different bacteria will thrive under different environmental conditions. Some will form spores. These are protective coverings on the outside of the cell. This is to protect themselves against destruction from heat, cold, lack of water, toxic chemicals, and radiation. Examples of spore-forming infectious diseases are anthrax and botulism. Other bacteria will thrive best in water, such as Pseudomonas species or Legionella. Some bacteria, such as Staphylococcus aureus, can survive in very high temperatures. Mycoplasmas, once believed to be viruses, are very small bacteria that do not have a cell wall. These tend to be slow-growing. For example, Mycoplasma pneumoniae can take up to 3 weeks to incubate before signs and symptoms will begin to appear. Rickettsia are small, round, or rod-shaped bacteria that are often transmitted by the bites of body lice, ticks, and fleas. Chlamydia is also a bacterium and is typically transmitted via close contact, especially sexual contact. Both are dependent on a living host. Cleaning, sterilizing, or boiling inanimate objects, such as glass or surgical instruments, can prevent the spread of infection after items are used by or on a patient. Viruses are not cells. They inject themselves into existing cells to reproduce. They do not have cell walls and cannot be treated with antibiotics or antifungals. Some viruses use the cytoplasm from the cell they have attacked to develop an envelope that makes it harder for the body's immune system to destroy them. These viruses can keep changing their protein markers, called antigens. This makes it very difficult for the virus to be neutralized or killed by white blood cells. New viral elements can be released into the circulation, either by the virus breaking down the wall of the cell it has invaded and releasing copies of its own genetic material, or by small offshoots bursting and infecting other nearby cells. Viruses are classified as one of three types. They can be latent. This means they reside in the body for years without producing symptoms and can then suddenly cause an acute flare-up of symptoms. An example of this would be the herpes simplex virus. They can be oncogenic. This means cancer-causing. This can alter the cell walls to the point where a cell becomes malignant. They can also be active viruses. These enter the body, invade a number of cells, and then infect the body. An example of this would be influenza. Viruses and bacteria will vary in their resistance to destruction by chemical disinfectants, but most can be easily inactivated or destroyed with heat. It is important to note that antibiotics do not help fight a viral infection, but antiviral agents like acyclovir can help limit the virulence of a viral infection if taken at the first signs of illness. Protozoa are one-celled parasitic organisms that have the ability to move. There are four main types, and they are named by their method of travel within the environment. They are called amoebas, ciliates, flagellates, or sporozoa. These microorganisms are typically found in water and soil. To cause disease, some protozoans must be ingested, whereas others are introduced to the body through the bite of a vector. This is a carrier, like a mosquito. This is one of the reasons it's so important not to drink the tap water in Mexico. It contains protozoa. Fungi are very small, primitive organisms that grow on living plants, animals, and other decaying organic material. They thrive in warm and moist environments. Fungal infections in humans are also called mycoses and can be classified into three main types. Cutaneous mycoses, these grow on the outer layer of the skin. Subcutaneous mycoses, these involve the deeper layers of the skin, subcutaneous tissues, and sometimes even the bone. Or a systemic or deep mycoses. This will involve internal organs. Fungal infections are difficult to eradicate once they have invaded a host because fungi will tend to form spores that are resistant to ordinary antimicrobial agents. Antifungal agents can also be given topically or systemically. However, they can be toxic to the liver and nervous system. Therefore, the course of treatment needs to be carried out cautiously and over a long period. Most fungal infections are self-limited, and they will not cause clinical disease. Opportunistic fungal infections, these are infections that occur in a person with a depressed immune system, are more typically found in patients with some form of immune compromise, and they would typically include species from Candida, part of the normal body flora, Cryptococcus, this is found in soil associated with bird droppings, which can infect any organ including the brain and meninges, and Aspergillus. This can be found in soil, dust, and decomposing organic material. Inhaled spores are usually the mode of transmission. A red, moist rash under inguinal folds and breast is a fungal infection. Helminths are worms. They can be round, flat, or hook-like, and flukes. These are all parasitic and are typically spread via the fecal-oral route. Prions. These are transmissible spongiform encephalopathies, or TSEs. They are thought to be called by prions. These are abnormally folded proteins. It is not fully understood how prions form, are transmitted, and how they cause disease. TSEs would include Creutzfeldt-Jacobs disease and bovine spongiform encephalopathy, also known as mad cow disease. Since prions are a protein and are not technically a living organism, there is no chemical that can kill them. The four primary lines of defense the body has against infection are the skin and mucous membranes, our normal flora, and the inflammatory response, as well as our immune response. Mechanical barriers are intact skin and mucous membranes. Skin, being the largest organ of the body, serves as the first line of defense against harmful agents in the environment. The portals of exit and entry provide the means for which pathogens can move in and out of the body. Chemical barriers can assist the skin and mucous membranes in fighting off invasive organisms through the secretion of tears, saliva, and mucus. Secretions from the mucous membrane lining the respiratory, GI, and reproductive tracts contain an abundance of a bactericidal enzyme called lysozyme. This same enzyme is found in tears and saliva. Stomach acid and digestive enzymes will kill off most swallowed microorganisms. It's important to note that Prilosec can reduce the amount of lysozyme in the stomach. Cilia line the respiratory tract. They line the respiratory tract and they trap organisms and debris with the help of mucus. Then they can propel them up and out of the body with a wave-like action. Our bodies have two forms of immunity. They are innate. This means we are born with them. They are natural. Or our immunity can be acquired. This develops throughout our life. When the body's defense mechanisms are stressed or exhausted, we are more susceptible to infection. General health, state of nutrition, hormone balance, immune status, and the presence of a chronic disease such as diabetes can influence the degree of susceptibility a person has to infection. Fever is one of the primary mechanisms that the body uses to prevent infection from invading microorganisms. The increased heat in the body creates a hostile environment to these microorganisms, and an intact immune system can then destroy them more efficiently. A fever up to 102 degrees in adults is typically not treated unless the patient is uncomfortable. Once the threat of infection is no longer present, the immune system again signals the hypothalamus, and then the body will begin to cool down on its own. Poor nutrition can predispose a person to develop an infection because the body might not have sufficient protein stores to generate enough antibodies to fight off an infection. Stress can increase blood cortisol levels, which will decrease the inflammatory response of the body. An antigen is a form of protein found on the outside of cells that allows the body to identify it as self or native to the body, or non-self, foreign to the body. Antibodies, also known as immunoglobulins, are one part of our acquired immunity. They have many different functions, such as neutralizing toxins and killing invading pathogens. There are 5 types of antibodies: IgM, IgG, IgA, IgE, and IgD. Bone marrow plays an important role in manufacturing blood products that help the body defend itself against infection. These products are called leukocytes, which include neutrophils, macrophages, and lymphocytes. Leukocytosis can be seen more often with bacterial rather than viral infections. The white blood cell count on the complete blood count should be used to identify any elevations. The process of phagocytosis is a form of innate immunity. This is the body's first line of defense at the cellular level. Within the first few hours of the onset of the inflammatory process, the monocytes will swell up, becoming macrophages, and then migrate to the site of inflammation. Neutrophils, which are a type of leukocyte, are also released and can then kill both aerobic and anaerobic organisms. After the macrophages and neutrophils engulf and destroy bacteria and other foreign matter, they will die, producing an exudate that is composed of tissue, fluid, dead cells, and their byproducts. This exudate is usually yellow or green in color and is commonly known as pus. This is a sign of infection. Macrophages are monocytes that have left the bloodstream and migrated to the tissues. They will ingest and destroy pathogens and clear away cellular debris and dead neutrophils in the later stages of an infection. As part of the innate immune system, about 50% of all macrophage cells can be found in the liver's Kupffer cells. The flora that are normally present on the skin and in the mucous membranes, GI tract, and vagina coexist with the body and control the growth of harmful pathogens. When the amount of our normal flora is diminished, other pathogens can cause an infection. For example, Candida albicans will commonly cause a yeast infection after treatment with antibiotics because the normal flora has been destroyed, allowing the Candida to flourish. Clostridium difficile is prevalent in the environment and is part of the normal flora of the bowel. Administration of antibiotics will disrupt this normal balance of bowel flora, allowing that C. diff to cause colitis. C. diff can produce a spore that is not destroyed by alcohol-based hand hygiene products. Inflammation is an immediate, localized, protective response of the body to any type of injury or damage to cells and tissues. It is considered our second line of defense to infection at the cellular level. The three basic purposes of the inflammatory response are to neutralize and destroy harmful agents, to limit their spread to other tissues in the body by walling off the organisms, and to prepare the damaged tissues for repair. Changes that are part of the inflammatory response can occur locally, at the site of injury, and systemically. These changes will involve the cells of the damaged tissues and their adjacent connective tissues, the blood vessels in and near the site of injury, activating the clotting mechanism, the blood cells, particularly the leukocytes, the macrophages and phagocyte activity, and the immune system as well as our hormonal system. An inadequate inflammatory response can cause an active systemic infection. Redness and heat are caused by increased blood flow to an affected area. Swelling is the result of increased permeability of the capillaries and leakage of fluid from the blood into the tissue spaces around the cells. Blockage of lymphatic drainage from the site will also contribute to local swelling. Pain is the result of irritated nerve endings. This is caused by chemicals released in defensive cells and the accumulation of fluid in the area. Systemic reactions to inflammation include headache, myalgia, fever, diaphoresis, chills, anorexia, and malaise. These are some of the more common signs and symptoms experienced with a systemic infection. Nursing care for patients with a systemic infection would include providing for balanced fluid intake and output, pain relief, and temperature control. Measures to ensure adequate nutrition and rest are also used. The complement system is a group of proteins that lie dormant in the body until they've been activated through an encounter with a foreign substance. The activation of these proteins will enhance phagocytosis as well as the inflammatory process. This process can be measured by the laboratory test C-reactive protein, or CRP. The third line of defense is the immune response. This attempts to defend and protect the body through a series of complex chemical and mechanical activities. These activities involve the detection of entry of foreign agents as soon as they gain access to body cells, immediate recognition of these agents as foreign or alien, and the ability to distinguish one kind of foreign agent from another, as well as to remember those particular agents if they come back again years later. They attack the foreign cells and neutralize the toxins those cells produce. Some hormones, such as cortisol, a glucocorticoid produced in the adrenal cortex, have an anti-inflammatory action that will limit inflammation to the locally damaged tissues. Therefore, these hormones have a regulatory effect on the inflammatory process so that the response is well balanced and provides maximum benefit. Infection occurs through a cyclical interrelated process, similar to links on a chain. Prevention or control of infection is aimed at interrupting the chain of infection. The mechanism of transmission of a pathogenic agent within the environment or to another person is either by direct or indirect contact. Vectors, such as mosquitoes, fleas, ticks, and flies, can transmit pathogens through their bites or stings. The three most important aspects in the infection chain are the interaction of the agent, the host, and the mode of transmission. A reservoir is any place a pathogen is normally found. The reservoir can be animate, which means living. This could be people, animals, or insects, or it can be inanimate, non-living, such as found in soil, in water, or on the surfaces of objects, such as a cup or on bed rails. Infectious agents can also be found in body excretions or secretions, such as saliva, sputum, urine, feces, and wound drainage. In the home or community, contaminated or improperly cooked food, stagnant water, or sewage can also be a source of infection. Hand hygiene is the primary intervention any healthcare provider can use to control the spread of infection. Hand hygiene can be performed with soap and water if hands are visibly soiled, or with an alcohol-based hand sanitizing solution for routine decontamination. It is important to note that hand hygiene must be performed regardless whether gloves were used or not. Artificial fingernails, extenders, or gels are not recommended for healthcare providers who have a direct patient contact because pathogens can be found beneath the nails. Standard precautions were mandated by the CDC in the 1980s. These precautions are designed to prevent the transmission of microorganisms from one patient to another, as well as to protect the healthcare worker from unnecessary exposure to infection. Standard precautions are to be used on all patients because their potential for being colonized or already infectious is not always known. Transmission-based precautions incorporate standard precaution techniques with additional protective actions specific to that organism and how it is spread. These safety measures should be implemented for patients with a suspected or confirmed infection or who are known to be colonized with a highly transmissible organism, such as tuberculosis, COVID-19, or Ebola. These additional precautions are known as airborne, contact, and droplet precautions. Depending on the microorganism involved, you will verify which type of transmission-based precaution needs to be used. Personal protective equipment, or PPE, involves the use of a barrier to protect a person from exposure to bloodborne pathogens, body fluids, or other potentially infectious materials. These barriers include, but are not limited to, gloves, cover gowns, face masks, eye protection, face shields, and respirator masks. Secretions can be on surfaces and then transmitted through touching the surface and then touching the mouth or nose near mucous membranes. By law, healthcare facilities are required to provide PPE at no expense to the staff. When caring for patients with COVID-19, eye protection, gowns, and gloves need to be worn in addition to your mask. Although the mechanism of transmission is not fully understood, droplet precautions are used with patients known to be infected with COVID-19. Airborne precautions are recommended for procedures that can aerosolize body fluids. Patients with hematopoietic stem cell transplantation or other clinical conditions that severely suppress the immune system will require highly specialized forms of expanded isolation techniques. These interventions should include special airflow and filtration rooms with positive air pressure, smooth surfaces to aid in disinfection, and minimizing the length of time that a patient is outside the protective environment. Two methods of preventing droplets from spreading to others are teaching people to cover their mouth when they sneeze or cough and turning the head away to prevent coughing into someone else's face. In addition, educating patients and families to dispose of their soiled tissues in waste containers and to perform hand hygiene after contact with actual or potentially contaminated items is important. Transmission of an infectious organism can be interrupted at the portal of entry by using only clean or sterile items when caring for patients. Use of effective hand hygiene techniques by healthcare workers, visitors, and patients is key in the prevention of infection. A healthcare-associated infection, or HAI, occurs when a patient is cared for in any kind of healthcare setting and then acquires an infection. There are specific criteria for the infection to be classified as an HAI, including length of time in the facility before the onset or appearance of the infection. Detailed documentation is essential in determining whether the infection the patient has was community or healthcare acquired. Multi-drug resistant organisms are organisms that are resistant to more than one type of antibiotic. Overuse of antibiotics has led to mutations of the organisms, making them resistant to antibiotics that were previously effective. The annual cost of HAIs is estimated to be $28 to $45 billion. Central line-associated bloodstream infections are the most costly, followed by ventilator-associated pneumonia and surgical site infections. Other infections included in the top 5 are C. diff and catheter-associated urinary tract infections. More than 650,000 patients per year develop an HAI. Insurance reimbursement may be denied or limited for increased length of stay and treatment costs for infections that were considered preventable. The primary way to break the chain of infection is careful attention to hand hygiene before and after any direct patient contact, before and after any invasive or sterile procedure, and after contact with any infectious materials, as well as before contact with any immunocompromised patients. However, for hand hygiene to be effective, you need to know what cleansing product to use. If the patient has C. diff or Candida albicans infection, the healthcare worker needs to use only soap and water to cleanse their hands. The alcohol and alcohol-based sanitizers would only make the spores for these organisms more sticky. It won't actually kill them. In addition, if a patient with C. diff is discharged, the housekeeping staff needs to know that the patient had this type of infection so that the appropriate cleaning agents can be used. Disposing of infectious materials, such as soiled dressings, full suction containers, and contaminated equipment in covered, moisture-resistant biohazard containers will help contain the microorganism as well as their odors. Along with preventative interventions and appropriate treatments, you must continuously assess the patient to identify any early signs of infection or its spread. Surveillance requires that nurses be alert for signs and symptoms of infection in patients under their care. Monitor laboratory results for an elevation in the white blood cell count. You should routinely assess patients for any unexpected elevation of temperature, malaise, cough, loss of appetite, foul-smelling urine, new onset diarrhea, and wounds that are red, swollen, painful, or have a foul-smelling discharge. Pay particular attention to these patients who are more susceptible to infection. These patients include those who are weakened by severe illness or injury, those with drainage tubes, intravenous catheters, or other invasive devices for monitoring their treatment, those who are very young or very old, those who have had a recent surgery, or those who are immunocompromised. In certain situations, transmission-based precautions may need to be instituted even before the culture results are available. Medical asepsis includes hand hygiene, separation or isolation of the patient, use of appropriate precautions for the handling and disposing of contaminated articles, and other techniques devised to contain and destroy infectious agents, including cleansing and disinfection. Surgical asepsis involves the sterilizing of instruments, skin, and other articles that will be used to perform surgery or other types of sterile procedures. Surgical asepsis must also be used when placing an IV catheter into a vein, when inserting a Foley catheter into the urinary bladder, during the placement of internal monitoring devices, or during other invasive procedures, such as a cardiac angiogram. Procedures being performed at the bedside that require surgical asepsis, such as a central line placement, will require that all people in the room wear a face mask and head cover. The patient must be covered with sterile drapes, and only sterile equipment and supplies are to be used. The door to the room should be closed throughout the procedure. If a patient's HAI or community-acquired infection is not adequately treated, the pathogen can enter the bloodstream, causing bacteremia and sepsis with a systemic inflammatory response. Symptoms of the inflammatory and immune response include, but are not limited to, tachycardia, tachypnea, fever, elevated white blood cell count. These clinical findings are known as systemic inflammatory response syndrome, or SIRS criteria. An altered level of consciousness can also occur. If the infection is identified and treated within its early stages, full recovery is possible. Patients who are at risk for sepsis need to be identified and then closely monitored for any changes from their baseline assessment, including a change in mental status, tachycardia, tachypnea, changes in blood pressure, and a decreased urine output. Pneumonia, urinary tract infection, and post-surgical wound infections are conditions that can lead to sepsis if not identified and treated. Some patients, often older adults, will experience hypothermia when septic. Sepsis is diagnosed from the clinical presentation of the patient, as well as the results of laboratory tests, such as an elevated leukocyte count, elevated lactate levels, and serial blood cultures that could be positive for invading microorganisms. Ensuring that the correct antimicrobial agents are prescribed in a timely manner can decrease the risk of the patient developing a multi-drug resistant infection and will also eliminate the pathogen as quickly as possible. Detecting infection in a patient will require a thorough nursing assessment. The interview should be based upon the patient's complaints. For example, if the patient states that it hurts to go to the bathroom, you should ask if there is also any urgency or burning when trying to empty the bladder. Data collection would include assessing vital signs, auscultating the lungs to check for abnormal breath sounds, inspecting the skin for lesions or rashes, and checking the urine for cloudiness, discoloration, abnormal odor, and increased specific gravity. In addition, look for signs of local infection, such as redness, swelling, pain, or tenderness on palpation or movement, heat in the affected area, and possibly loss of function of the affected body part. Take a look on page 118 in the red box, Older Adult Care Points. Many older adults, especially those older than 80 years, have a low baseline body temperature. Because of their decreased inflammatory and immune response, their temperature may rise very little in the presence of infection. Small increases in temperature in these patients can be quite significant. Signs of inflammation may not be present or may be milder than what is typically seen in a younger person. A decrease in mental alertness, increased fatigue, or sudden onset of confusion, irritability, or apathy can be a clue that an infection is present. Laboratory data that can indicate infection would include an elevated white blood cell count, changes in the distribution and number of the various types of leukocytes, elevated CRP, and microbiology cultures that test positive for microorganisms. When obtaining a culture, be careful to use aseptic technique whenever indicated and with sterile equipment. Make sure to collect fresh material only from the suspected site and avoid contamination from microbes in nearby tissues and fluids. Use the appropriate container for the sample, making sure that your container is correctly labeled and tightly covered to avoid any spilling and contamination during transport to the laboratory. Ideally, specimens are collected before antimicrobials are initiated, but if there's difficulty obtaining a sample, drug therapy should not be delayed. Sensitivity tests are done in conjunction with microbiology cultures to determine when antimicrobials can most effectively destroy or inhibit the multiplication and growth of specific infecting microbes. With some infectious diseases, such as tuberculosis, blood tests can be done to look for antigens or antibodies. Radiography, such as X-rays, CT, or MRI, can be used to detect changes in tissues or organs in order to locate abscesses anywhere within the body. The specific type of infection and the problem it presents should determine the correct problem statement. Any patient entering the hospital for surgery or an invasive procedure is at risk for an HAI. The planning phase of the nursing process should take into account the physical strength of the patient and their need for rest. Every effort should be made to maintain the integrity of the skin and mucous membranes so that they can continue to serve as effective barriers to infectious agents. Providing a quiet environment with uninterrupted rest periods is important in the recovery process. Provide patient teaching and family teaching regarding the infection. Include the purpose of diagnostic tests, treatments, and any special precautions, and include why the family needs to help maintain medical asepsis in order to prevent the spread of infection to themselves and others. Administer antimicrobial drugs on time to maintain effective blood levels. In addition, monitor the patient for drug side effects and evaluate the progress of the patient to determine whether the drug is effective in eradicating the infection. There are two primary categories of antibacterial agents, narrow spectrum and broad spectrum. The most common side effects are nausea, vomiting, and diarrhea. A broad spectrum antibiotic can attack a larger group of organisms. However, these agents can also cause superinfections because they kill off many of the good bacteria within our body. Antiviral agents can interfere with the DNA or RNA synthesis required for the virus to duplicate itself. The most common side effects are headache, nausea, vomiting, anorexia, and diarrhea. The more severe the side effects would include acute renal failure, encephalopathy, and bleeding disorders. Antifungal agents. The most common side effects are headache, fever, chills, nausea, vomiting, and anorexia. More severe side effects would include acute kidney and/or liver failure and hemorrhagic gastroenteritis. Antihelminthic agents will cause paralysis of the invading parasite. Common side effects include dizziness, headache, fever, nausea, vomiting, anorexia, diarrhea, and rash. When under excessive stress, the body is also less able to mobilize the elements and cells that promote healing. Nurses should realize that the attitude shown towards a patient and the ways in which you strive to meet their needs can reduce stress and promote healing. If an illness is lengthy, concerns about work and home responsibilities may cause anxiety or increase a patient's stress levels. Therefore, collaboration with a social worker or case manager for solutions to these problems might be needed. Before beginning teaching, find out how much your patient or family knows about their condition, as well as any problems that could arise. A patient taking an antimicrobial medication at home needs to be taught how to take them as prescribed, and not to discontinue any antimicrobial medication, even if the symptoms are all gone, until all medication has been taken. Explain to the patient and the family that stopping before the full amount of medication has been given can lead to a superinfection and possible readmission to the hospital. Controlling the spread of the infectious disease within the community is accomplished within conjunction from public health officials. Their major goals, and those of nurses who work with them, are to promote sanitary standards in our communities, identify persons who are highly susceptible to infection, and reduce their chances of developing an infectious disease, and to provide immunization programs to protect people against certain communicable diseases. All people living in the home should be instructed to wash their hands as soon as they return home from being out in a public place. The incidence of colds and flu can be decreased if during influenza season, people who are at increased risk of infection would stay away from crowded stores and theaters where pathogens are likely to be airborne. The home care nurse should also teach the techniques of medical asepsis to patients and their family members, in order to prevent cross-infection from one person to another or the spread of infection in the patient. Surfaces contaminated with traces of blood, urine, feces, or vomitus should be sanitized using a clean cloth, soap, and hot water, then re-cleaned with a 1 to 10 solution of chlorine, bleach, and hot water. Within the home, the patient and family are taught to contain infectious waste, such as dressings and soiled tissues, in a sealed, impermeable bag to minimize odors. The bags can then be disposed of in garbage cans outside of the home. Obtaining adequate sleep, eating properly, and exercising regularly will contribute to increased resistance to illness and infection. Adopting effective stress reduction techniques and using them regularly can also be beneficial. Older adults in long-term care or assisted living facilities often have chronic illnesses that add to their susceptibility. Help residents wash their hands before meals and after toileting, before and after being in community rooms, such as a dining room or social activities lounge, and anytime their hands become soiled.